Welcome to our first part of our series on sciatica. I'm Chip Mosley here in our Raleigh, North Carolina clinic of Total Motion Physical Therapy. And today in part one we're going to be talking about signs and symptoms. Well, first of all, our definition of sciatica is basically there's a nerve in our body, which we'll talk about where it is in just a moment. That anytime you get a nerve that gets pinched on it, it creates symptoms that are kind of neurological symptoms. It could mean it's pain, could mean it's numbness, could mean it's tingling, it can create weakness, all of these types of things. But a pinch on the sciatic nerve is something called sciatica. Now, in terms of the anatomy of the sciatic nerve, it starts off as some little nerve rootlets coming off our spinal cord here in the bottom curve of our back. We call it the lumbar spine. And it clumps together along with some nerves that are also coming out of the tailbone area or the sacral area of our spinal column as well. Then as it comes out of the spinal level, it clumps again to form that big nerve, and then it goes deep into the buttock region. After coming deep into the buttock region, it comes out, it goes down the back part of the thigh. Right around when it gets closest to the knee, it'll split off and it'll form a couple other nerves that go down into the lower leg and into the foot. So with that, location of symptoms could be anywhere along that distribution there. In order to call it sciatica, we have to have some leg involvement, but they certainly can have, you can certainly have back symptoms that go with that. You can have symptoms in that buttock area. We can have symptoms down the back of the thigh and into the lower leg all the way down to the foot. And now, depending on where it is pinched, we'll go over this in a little more detail on a later lesson. Different parts of it being pinched might hit different parts of the leg or different parts of the thigh and so forth. But for the most part, it's going to be in general in those areas. For example, if anything is more on the front of a thigh, we don't typically think of that as sciatica because the sciatic nerve doesn't travel down the front of the thigh. It's got to be more so down the back. Now, in terms of the locations of the pinch, same thing. We can have a pinch at more of the spinal level itself if there's a change in alignment of a bone or a bone spur coming out or something at the disc. There can be things from the pinch in the buttock area. There's a deep muscle down in there called the piriformis muscle that has a very intimate relationship with the sciatic nerve. On the majority of people, it's going to travel just like 1 inch just above or below this little muscle. But on about 20% of people, it actually pierces right through the heart of this muscle. So this could be a tightness or a strain in that muscle, the piriformis, that could create these symptoms. And similarly, along any of this distribution of all those places that it could travel, any place you have a soft tissue or a bony or something else that could tighten or shift and create a pinch, it could create these nerves of sciatica. Now, acute or chronic, most commonly in the clinic we see probably more of the acute. However, it can be really in either category. So we certainly see people come in and say, I've had this leg symptom for years and decades and so forth. Does that mean it can't be treated? Absolutely not. A lot of the times you just have to know how to address it. But of course, the longer it goes, the deeper the issues are running, the more complicated, the more compensations happen, it can make it more complicated to treat. So certainly we do recommend if you have any signs of these symptoms, the earlier you can get in to address it, the better, especially if you're trying to avoid surgery. 1 leg or 2 legs, the most common presentation in sciatica is more so in 1 leg. However, it can be in 2. If things are in both legs at that point, it's definitely taken a deeper progression into a place that makes it potentially getting more likely to be more serious and even surgical. So these are things, again, here in 2 legs, get help right away in particular, even more than if it's in 1. And this does make it a little more complicated to treat. Doesn't mean it can't still have success with conservative treatments. We've had a lot of success with 2-legged sciatica patients. However, it just means it's a little more fancy. And traumatic or no trauma, most of the people who come into our clinic aren't going to be describing, hey, I fell down the stairs and all of a sudden these things started to happen. It's a conjoining of a lot of the things that's happened in my lives over a period of time. And the tightnesses in these muscles or these changes in alignment of these bones and so forth, or these pulls on these discs that happen in the local places that lead to the sciatic nerve we just talked about could have even started as an injury in another place. I hurt my knee 15 years ago. I hurt my shoulder and had surgery on it 20 years ago. And it's that lingering tightness and change in those older injuries that can pull on and affect and lead to compensatory changes down in the lumbar spine, sacral region, buttocks, and so forth and lead to these sciatic nerve symptoms. That's why, even though we'll have a good way to diagnose and look at it, we'll talk about in a later lesson, just for that area itself, with a lot of tests we like to do, technically the causation of it, we have to look at the whole body symptom to really have a good understanding on what's really leading to the sciatic nerve issues. Well, hopefully that is helpful, and we'll lead into the next section as well, where we're going to talk about more about diagnosing sciatica, and we'll look forward to that next time.